Okay, tell us a little about yourself.
Okay, I am a nursing student at Delaware State University. I will be graduating in May of 2023. I currently work at a school with children as a reading assist tutor. I help them with their reading skills and follow a lesson plan, and I see them about 4 days a week, sometimes 5 on Fridays. I enjoy working with people. I've always worked in customer service and just recently switched to working with children. And yeah, I consider myself to be a very independent and dedicated individual who really values time management skills. And I feel as if I have learned those throughout my nursing school career.
Okay. So, tell us why you want to work for this organization.
I want to work for Delaware State Hospital, specifically in the med-surg unit, to fortify my nursing skills as a new graduate nurse. I think working in med-surg would be most ideal because you get to see everything, and I have learned that throughout my adult health med-surg clinical rotations. I think I would enjoy the fast pace and how it's very different every day. You never know what you can get in a med-surg unit, and that just keeps it exciting. I also think that I would be willing to work with patients who have all types of different conditions. I specifically value mental health, and I think that is very important as a new grad nurse, especially because a lot of the patients that you see in med-surg units sometimes have different mental health conditions that you have to take into consideration, along with whatever they might be in there for.
Okay, thank you.
What areas do you know you need to work on, and how would you approach improving upon them?
I definitely think I would need to work on just fortifying my clinical skills. Due to COVID, I feel like our clinical experience was cut short, or like direct hands-on in the hospital setting, again due to COVID. So I would really want to work on learning those basic skills and mastering them.
Okay. Do you consider yourself a team player?
Yes, I grew up in a very big family, and in a family we were always told to divide and conquer, and I believe that same concept can work in a nursing setting with the different teammates that you get to work with, such as your patient care tech and the technicians that come in and do lab work, and the provider and other nurses. I think that's very important. So I would definitely consider myself a team player.
Okay. So if you come across a difficult doctor, how would you handle a difficult doctor?
If I came across a difficult doctor, I think I would try to communicate with them first and see what a potential solution for us could be, if there was a specific problem, or perhaps if it was his attitude. Perhaps I would talk to maybe a colleague for advice and see if they had the same issue with this specific provider, and definitely stand up for myself and just kind of see where the situation would go, but definitely try to fix it for myself first and communicate with him directly, and then maybe seek advice elsewhere with a manager if it needed to be taken in that direction.
Okay, thank you.
How do you deal with difficult patients and or their families?
I worked at a hospital, VB Health, over the summer as a patient care tech and shadowing a nurse. So I came across a couple difficult patients in my time there. And I think my way of dealing with them was communicating always what I was doing and staying professional to what my job required. Never took it personal because a lot of the times these patients just mentally have certain problems, so you can't really ever take it personally. If it were to ever come to a situation where I myself were in danger, I would definitely seek my nurse manager. But most of the time it's difficult patients and that they sometimes don't always have respect for you. And just because that happens doesn't mean that you lose respect for them. As a nurse, you should always keep that in mind and know what you're there for to help them, no matter what their mental state might be. And same thing with difficult families, just make sure that you're always communicating what you're doing, what type of care, what you're there for. And if they don't seem to understand that, then maybe someone else could speak to them, but never take it personal, get offended.
Thank you.
Okay. Let's say you, what, oh, this is 2007. Okay. Let's say you have a situation such as short staffing and you're having to perform a treatment that you've never done before. How would you handle it?
That I've never done before. Is it like a medication treatment or just any type of
Like just
treatment?
any type of treatment on the floor.
Sure. I think I would go to my sources, perhaps look it up on a reliable source and fortify my knowledge on it and make sure that I understand it completely before I do it. And if I were to not completely understand it from reading or informing myself about it, perhaps ask a colleague if they have time to explain the treatment.
Okay, thank you.
You're welcome.
So the next question is a scenario, just ask me to repeat it if you need to. So you're preparing to do a dressing change on a patient with a stage 4 sacral ulcer. What 3 priority interventions would you plan for before starting the procedure?
Before starting the procedure, I would first assess the pressure ulcer for any signs of infection, and then I would, after my assessment, I would gather the supplies that I need for wound care and whatever wound care is appropriate depending on my assessment. And thirdly, I would assess their pain level and make sure, since it's on the sacral, advise them that they should perhaps do a position change if they haven't been turned for a while. And then based on their report of pain level, also provide any type of pain management that they might have prescribed to PRN.
Okay, thank you.
You get 2 difficult clients at the same time, both demanding your attention. What do you do?
I would probably go to the patient that is highest priority first, but definitely communicate to my second patient that I will be right back. And if it's not too busy on the floor, perhaps I can ask PCT to go in there in the meantime to see if there's anything that they might need while I'm with other patients, such as water, or maybe a new change of linens or something like that.
Okay, please state briefly a time when you had conflict in your professional our personal life, how you managed it, how you handled it?
Conflict. I would say that the first scenario that comes to mind was just recently in my maternity clinical. We were in the C-section. We were in the operating room dealing with the C-section, and the baby came up breech. He was breech, and the baby wasn't crying at first. And for me, it was an internal conflict, trying to remain strong for the parents, but it was definitely a very scary scenario for myself. But I think I dealt with it by reminding myself what this profession is about, that we're always gonna see hard things, and it's really important to just keep it together in the moment, because it's probably harder for the patient themselves.
Okay, so I have another scenario for you. You're assigned 3 patients. You have 1 nursing assistant to help you. The charge nurse gives you the following report. Patient number 1 has pain that they are rating as an 11 out of 10. Patient number 2 was just diagnosed with terminal cancer and wants to talk to their nurse. Patient number 3 has acute mental status changes and keeps pulling out their NG tube and IV. Who would you see first and why? And what would you delegate to the charge nurse and the CNA as you start your shift, and why?
I'm sorry, could you repeat the third patient? They have acute mental status?
So this 3rd patient has acute mental status changes and keeps pulling out their NG tube and IV.
I would first go to the patient who had the acute mental status change, because that's priority. There was a change. I would need to go in there and assess what is going on. And they're also pulling out their IV and NG tube, which could lead to potential aspiration or infection. So their priority. For the patient care tech, I would delegate perhaps the patient who has the pain, 11 out of 10, because in the meantime, while I'm dealing with my first patient, perhaps they can offer comfort measures that aren't obviously like pharmacology or medication. They could do like perhaps position changing or get them a cup of water, anything that might help them relieve that pain in the meantime. And then you're delegating one to the charge nurse as well?
You can.
Perhaps ask the charge nurse to go into the patient who just got diagnosed with cancer, to have a support person just in the meantime that I can become available, because you don't want to disregard whatever feelings. That's something really, hard to go through, just so that they have that support person in the meantime.
Okay.